Hello, my name's Kate. I couldn't start a talk in any other way these days, and I'm going to tell you a bit more of the story of how #HelloMyNameIs was born and why that four-word phrase has become very important and quite magical. The response to the Hello My Name Is tour has been absolutely incredible, and it was wonderful to see so many County Durham and Darlington staff in one place at one time to hear the story, because I think the story is very powerful, and when you hear it in real life, it's that powerful story that people take away and reflect on and think about.
Hello, my name is more than just a courtesy. It's the start of a relationship. It's establishing trust. Our patients are dependent upon us for everything that they need when they come into hospital or when we visit them at home or in the clinic elsewhere. So this has been a really important day in the life of this trust.
We've been at it now since the 2nd of February, so we joined the national campaign with 100 trusts. So already it's reasonably embedded in lots of areas. I think this will just give it another leg up, and I hope that not within a few years but within the rest of this year we are able to say that genuinely everybody is following the mantra that is Hello, my name is.
Little things make the biggest difference to patients. We all do tiny acts of kindness every single day for our patients without even thinking about it. But they're the things you take away and remember as a patient. They're the things that make a difference between a good experience and a poor one.
I think it's extremely important for patients because, as Kate has just explained to us there, it makes them feel as though they matter. And I think as a nurse it's the most important thing that you can do for any patient coming into the organisation, of where you're going to deliver care that they feel safe and feel comfortable.
It's been fab. I've been looking forward to it for ages. I've known about it for a few years now because we learned about it in university, and I have her on Twitter, and I've been following #HelloMyNameIs for a while. So once all of our trusts started introducing it, I was so excited.
I think everyone needs to listen to what Kate has to say. She is an inspiration to everybody, and I think what she's gone through makes you a little bit sad that we aren't introducing ourselves to our patients. I think it's first impressions, and it makes a huge difference, is what Kate has said. And to hear that people aren't introducing themselves makes me quite sad, really.
During that time I met lots of people, and the majority of them didn't introduce themselves to me. The consultant on the post-it ward round didn't introduce himself. Lots of the nurses who did my antibiotics didn't introduce themselves. Lots of the healthcare assistants doing my observations didn't introduce themselves. But when somebody did, it made such a difference to my day. It made me feel human again.
We talk about the vast number of patients that come through our doors. We talk about all the interactions that we have, the pressure that we work under every day. But what Kate's pointed out to us is there aren't thousands. There's only one. There's only one patient that we interact with at a time. The patient in the bed in front of us, the patient in the clinic. And what she's talking about is recapturing the humanity around nursing and healthcare.
I speak to a lot of patients and a lot of relatives, and as you'll be aware, when you come into hospital it is a vulnerable time, and just having that connection and being able to develop that trust with that clinical member of staff or non-clinical member of staff is so important to you feeling confident, getting the most out of your treatment and feeling like a human being, which at the end of the day is what we all are.
I can't stand the thought of people feeling sorry for me and me becoming that tragic young doctor who died of cancer before her time. I really want to become somebody who changed the health service for the better, that made us all a more positive place to work, and really pushed patient experience and compassion to the forefront of everyone's thinking.
Her message has meaning to everyone in this room who's taken time out of their busy day, maybe staying back after the shift has ended, to listen to what Kate has had to say. And the message that they've taken from Kate's visit will be disseminated throughout the rest of the organisation.